Have eminent doctors amongst us. At times it is very difficult to get appointment from them. So let's take this opportunity to hear them and let's dedicate this to the wellness of our members. Having said so, let me just say, see, all this time we have had situation of various incidents. I have witnessed we have not been able to save life, although in 5 minutes we have taken somebody to MR Bangur Hospital. All these years, actually, we really never felt the need for a emergency situation, how to handle it, because in fact, Oli is fortunate, I would say, that across the road you have MR Bangur and we have saved a lot of lives. So I must say that MR Bangur has come to our rescue number of times. Now, when this situation happened, then we thought that now this is the time. There is a much needed facility that TOLI members and entire stakeholders need this kind of a facility. And then we started working in earnest. We discussed in our committee. Then fortunately, Arnav is a part of our, he's a chairman of our equestrian committee, and he's been very helpful. So when we floated the idea, Arnav has accepted. So thank you, Arnav, so that we can see this light of the day. Stages gathered for recreation, fitness, social events, and learning activities. With such a vibrant and active environment, it is essential to prioritize the safety and well-being of every member. This, I would say, is one critical step in that direction in establishing a dedicated first aid facility. Thank you.
Once again, much thanks to the President and the entire GC, which decided that we should start this, and I think we've been able to stick in some time, but we are there. Also thanks to Rishad Chenoy. Rishad, Safety Committee also pushed us towards it with Dr. Deepakar Datta. I am now going to request Ainab to take over the proceedings, and he's going to have a set of activities here to keep us all aware.
Sarkar with us and Dr. Shubhai Banerjee here. From the context of clinicians, I mean, it can be a cardiac issue, it can be a stroke, it can be a injury where one's broken part of your bone. Now, so we have the specialists with us, and we want to hear from them in terms of what would be our expectation from this clinic. Dr. Kapoor, would you like to go first?
Thank you, Ainab. Obviously, when it comes to club and sports, an orthopedic surgeon kind of gets a chance to speak first, and that's what has happened just now. But believe me, every organ in the body, and especially the heart, has to work better than all other things in order for sports to kind of get a realistic sort of footage. So for me, we have been a very, very strong team of clinicians which has been able to kind of bring integrated care in this city, and with seniors like Kunala and people who have kind of been around, it is obviously impossible not to get the best in healthcare in one particular place. Now, regarding sports, we cannot isolate sports. Suppose I say I would treat a golfer with a shoulder problem, a tennis player with a shoulder and knee problem, or somebody who is doing a lot of running activity with a knee problem or a hip problem. It does not mean that it will only happen to young children. It will happen to everybody at every age. And the treatment starts changing from the childhood till the time we are playing or even walking on the roads. Go on the sports field are far more into day-to-day activities which are much more important in twisting, turning, creating spine issues, knee issues, back issues. A fall from the horse while riding can lead to some very, very severe problems. Now, these problems can be, of course, addressed by us at a level of speciality, But I think at this point of time, the initiative which Tolly Club has been able to take, along with handholding of Manipal hospitals, and we have been able to, as clinicians, we hopefully would be able to support you. Till now, in individual capacities, we have done this. I'm sure all of you have been somehow been touched by one of us in some part of our practices. But yes, I would reiterate what Ainab has just said. The health checkups are important. The training of our caddies with whom I have played here on these courses is very, very important. Even the training of the people who have been working with us in Tolly Club for a very, very long time, it needs to be done on a day-to-day basis. It can save us a life. Even when they are sitting and resting in Shamiana, something can happen, and if we have trained our people who work here in saving lives, that will be the first step. And after that, of course, we can take care of special issues, the difficult issues, once that life comes back. And that as doctors and as the team Manipal is always there, that is a larger context with which we are discussing. But the first thing first is that we need to make sure the society on day-to-day basis, if we have to fail 100 times or invest 100 or 1000 times in something which is futile, but if it can save one life, it is worth the effort. And that it has been able to handhold us and has been able to partner with us, that we can create that kind of ecosystem. And I'm sure this will be followed up in all different places where sports and large number of membership of the society actually goes. I